Hello, everyone. I'm Dr. Nicole Mittmann, the Chief Scientist and Vice President of Evidence Standards at CADTH. I'll be moderating today's webinar on surviving the COVID-19 infodemic. So let's talk a little bit about today's topic. According to the World Health Organization, the world is fighting the COVID-19 pandemic on two fronts. First is obviously the virus itself, but second, and just as dangerous as the virus, is the COVID-19 infodemic. An overwhelming flood of information, misinformation, rumors, premature data, and potentially scams that make it hard to know what to trust. Misinformation can be deadly, leading to people to try and take useless or dangerous treatments. Misinformation can also hurt the public health efforts in the control of COVID-19, and it undermines trust in facts, evidence, and science itself. Let's talk about the speakers that we have today presenting. We have two great speakers to help us navigate this unprecedented and frequently overwhelming COVID-19 infodemic. First up is Professor Timothy Caulfield, who is the Canada Research Chair in Health Law and Policy, a professor in the Faculty of Law in the School of Public Health, and the Research Director of Health Law of the Health Law Institute at the University of Alberta. He's also the author of two national bestsellers and the host and co-producer of an award-winning documentary series. His new book, entitled Relax, Damn It, A User's Guide to the Age of Anxiety, comes out later this year. Professor Caulfield will talk about how to debunk misinformation and other work underway to combat the spread of misinformation. Our second speaker is Barbara Greenwood-Dufour, from CADTH's Implementation Support and Knowledge Mobilization team. She develops strategies and tailored knowledge mobilization products to increase the awareness and uptake of evidence. Barbara is going to provide us with some practical tips and tools to help you find reliable sources of health information and evaluate its quality. So after the two presentations, we'll take some questions, and you can submit a question at any time using the Q&A tab in the Zoom control bar. And now, Tim, over to you.
Well, thank you very much for the opportunity to speak today. I am going to talk about the ways in which we can fight the infodemic. That I'm going to make this claim that debunking works. We all need to get involved, and yes, evidence matters. This is a topic that we've been exploring. We were fortunate to get one of the CIHR grants on the COVID issue, and our grant is focusing on this exact topic, how to deal with misinformation. And as everyone knows, there is a ridiculous amount of misinformation out there. Some of it is genuinely extreme, right? You have the idea that it's caused by 5G technology. You have this belief that it is a bioweapon. There's even this myth, I don't know if you guys have heard this one, that it came from a comet, right? And of course, then there are things like the big pharma stuff, that there's special diets that you can take. There's so much misinformation out there. I'm just waiting for the idea that this came from the grassy knoll, right, in Dallas. This is where we really are when it comes to misinformation in the context of the coronavirus. But in addition to that, I think we need to recognize that people are believing this stuff. That this misinformation is circulating, and there are individuals out there that are believing it. So there's studies that have come from the UK, for example, that found that over 1/5 of the people believe that the coronavirus is a hoax. Data from the United States has found that nearly 3 in 10 Americans believe that it was made in a lab. This one I think is really interesting. So 1 in 4 Republican voters believe the Bill Gates conspiracy theory. And the reason I think that is worth noting is this is a pretty extreme conspiracy theory. They believe that Bill Gates is supporting the idea of a vaccine so he can implant a microchip in people in order to monitor them. And yes, there's data from Canada. Over half of Canadians believe at least one of the dominant conspiracy theories. So those are pretty shocking numbers. Just to give you one example, I've lost the ability to control my slides. There we go. To give you one example, this was research that was done at Carleton, came out very recently, and it found about 26% of Canadians believe the bioweapon conspiracy. And if you look at the numbers, the 18 to 29%, even more in that demographic believe it. And the researchers speculate because of exposure to social media. But the bottom line is a lot of people are believing this misinformation. But there's other kinds of misinformation out there that isn't as extreme, right? And I think this is something that our group is really interested in. You have these kind of extreme conspiracy theories that are really having an impact on beliefs. But there's more sort of subtle stuff out there. And one of the ones we're really interested in is this idea that you can boost your immune system. And where is this information coming from? Well, it's coming from absolutely everywhere. I'm very interested in the celeb culture and so how celebrities are shaping this discussion. And one of the reasons that's important, it's interesting in its own right, but it really highlights the degree to which this is a bottom-up phenomenon. In other words, misinformation is being spread by individuals, right? Misinformation is being spread by the public. So this was a study that came out of Oxford, again, not that long ago. All this data is emerging relatively recently. And what they found is, they looked at misinformation that was being shared, okay? And they found that about 20% of that misinformation came from prominent individuals. They came from, celebrities, from sports stars, from politicians. So that's a pretty big number in itself. But what's interesting for our purposes is that 69% of what's shared out there is from prominent individuals. So in other words, ordinary Canadians, ordinary citizens are sharing this information and allowing it to circulate. So that's really important. I'm going to come back to that. As I said, there's a lot. You have the extreme information out there, the extreme kind of conspiracy theories, but you also have the stuff that has more intuitive appeal, and we're really interested in this idea of immune boosting because it's a scientifically questionable concept, right? But you see it everywhere right now. We're mapping the uptake of this idea. But things that are not going to boost your immune system: yoga, chiropractors, homeopaths, naturopaths, herbalists, and no Tom Brady supplements are not going to boost your immune system. But you see this out there, right? Another thing that we're looking at is the concept of immune boosting on Instagram. Now, this is a platform, one of the single most popular social media platforms. And one of the interesting things that we found, and this is preliminary data, we're just starting to collect this, is that there is almost zero scientific discussion on Instagram about immune boosting, but the concept is absolutely everywhere. I personally looked at hundreds of posts on Instagram about immune boosting, and I didn't find not one scientific critique of the concept, right? So this subtle information is out there, and I'm going to argue that it matters. Another thing that we're doing, this is a preprint that we've just finished, a study that we've just completed, that looks at internet postings of the concept of immune boosting. So these are websites that talk about immune boosting. We look at over 200 of them, and we found that 85% of them portrayed immune boosting as beneficial for avoiding COVID-19. So think about that, right? Think about that. First of all, the concept of immune boosting is scientifically suspect. And the idea then that this could have in some way be beneficial for COVID-19 is simply ridiculous. And you can see there at the bottom, we found that less than 10% of the websites have any kind of critique of the concept of immune boosting. So this is really, really problematic. And then, of course, we come to the emerging anti-vaxxer issue. So the anti-vaxxers came into this conversation relatively early. We started seeing it, February, March, really started to see a lot of misinformation starting to circulate. And think about that, the vaccine hasn't even been developed yet. And we're already starting to see the anti-vaxxers position themselves in this space. Not only are they raising concerns about safety, but they're also using this as an opportunity to talk about government overreach, the idea that the coronavirus vaccine is going to be used to make all vaccines mandatory, trying to scare you into the idea that that now the government is going to make this mandatory, and then they try to make mandatory seem particularly fearsome. So you have that rhetoric emerging, and unfortunately, it really is having an impact. And I'll come back to that in a bit. So what is the problem? Why do we care about misinformation? Well, everyone, I'm sure, can appreciate the problems, but let's go through some of them. First of all, there's physical harm, right? Physical harm, and even deaths that have been associated with this misinformation. Something that's often overlooked, but I think is really important. We just heard the President of the United States make more sort of offensive comments about the coronavirus. It increases stigma, it increases discrimination, it has resulted in property damage. The hydroxychloroquine debate really highlights how it can have science and health policy ramifications. And the last one I think is really important because it's often overlooked. It just adds to the chaotic information environment that makes it more difficult to get the good science out there, right? The good recommendations out there. Now, we are starting to get a little bit of evidence that this is happening. This is an interesting study that came out, again, just a few weeks ago that really speaks to that last point, that people are feeling overloaded by the information that's out there, that this chaotic information environment is having an adverse impact. And it is also, not only is it just confusing people, but it's making people making it more likely that people will believe false stories, right? And I think part of that is just it becomes difficult to sift through what's real and what's not real. And then, of course, there are a lot of examples, tangible examples of some of the other things, like arson, property damage associated with the 5G conspiracy theory. As I said, there's examples of racial tension emerging, and physical harm and even death. So this is really problematic. Going to this idea that it's having an impact on health and science policy, I think, as I said earlier, the hydroxychloroquine story is a really good example of this. So we have this misinformation starting to circulate early. A lot of it is built on one small study, the French study that was, had methodological limitations, and then, of course, endorsements by prominent figures like Elon Musk and Donald Trump. And then this study was in JAMA in late April. They just highlight how internet searches, which are a pretty good metric of public interest, right? How internet searches respond to that misinformation and that hype. And it has an even more tangible impacts where you can see, that the prescriptions of hydroxychloroquine, and again, keep in mind, the clinical data is very iffy. And now I think there's emerging consensus that it probably isn't effective, but you see the hydroxychloroquine prescriptions up 2,000% as a result of comments by Trump. So this misinformation has a real impact. So let's take a look at what the data is saying about vaccine acceptance in this space. Now, I find this data really depressing. You would think, given the reliance, how the emphasis on the importance of a vaccine, that there would be greater interest in using it. So here, this is data from the United States that found, it was from April, that found 23% of the samples said they would not get it, which is pretty high, right? It was pretty high if you fold in those individuals that are sort of marginally hesitant, and then you throw in practical implications of trying to get the vaccine out there, access issues. You're looking at a lot of people not getting the vaccine. This was another study, a little bit more recent, that found that only half of Americans said they would get it, right? And then, as I said before, layer on top all those other issues associated with rolling out a vaccine and vaccination hesitancy, and those are really worrisome numbers. Here's some data from Canada, again, coming from that Carleton group, who had a really, I think, interesting study. A colleague of mine, Gordon Pennycook, found very similar data in some unpublished data that's not quite out yet. But again, you're looking at about 27% of Canadians saying they're not sure or will not get the vaccine. So really, really worrisome. And for sure, I'm speculating here, but I think it's a reasonable speculation. For sure, a lot of this is tied to the spread of misinformation. So what can we do? How can we respond? Of course, this is something that our group is really interested in. Well, first of all, we absolutely have to get the social media platforms involved, right? We have to, and we can talk about that in the question and answer period, because that is actually a complex issue. But for sure, they have to get involved, and it's nice to see that they are, right? They are taking some steps to deal with this. We need the regulators to get involved, to shut down the entities that are selling unproven therapies, to shut down entities that are spreading misinformation. And we're starting to see that happen. In the United States, both the FDA and the FTC have been pretty aggressive, right? Now, they're not going to get everyone, but they've been pretty aggressive, and they've, provided good examples, good precedents. And we're seeing it happen in Canada too. Health Canada has also sent out warning letters, and they have this website here where you can complain, you can let Health Canada know that you've seen something. So this is good news, but it's not enough. I really do think all of us need to be involved in trying to counter misinformation. We all need to be involved. And so what can we do? Well, the good news is that debunking does work. It really does work, despite, people may have heard about the backfire effect, and I'll touch on that in just a moment, but it really does work. This is a study that came out last year, summer, I believe it was last summer, where it was a fairly big study, fairly robust study, where they found that if you provide good facts, and you uncover the rhetorical devices that are used to spread misinformation, so misrepresenting risk, using a conspiracy theory, you can have an impact. It can work, as this study found. But this study also found, and I think this is important, and there have been others that have found this recently, they also found no backfire effect. So in other words, providing facts did not cause people to become more entrenched in their views, and it did not have spread the misinformation further. So that's good news, right? That's good news, and there have been other studies that have found that also. This was a study that's directly on point. They found that providing facts in the context of a public health crisis matters, right? It can have an impact, especially if that information comes from a trusted voice, like CADTH, like the public health agencies. So this matters, right? And so that's good news. So let me go through a couple of other things that I believe are tools that can inform how we should message our counter misinformation strategy. So first of all, number one, as I already said, providing good evidence helps, right? Use clear and shareable content. Think about how what your debunk is going to look on social media, how it's going to look on Twitter and Instagram and on Facebook. Think about that. Use trusted independent sources. I know that can be challenging. We can come back to that in the Q&A period. And if possible, talk about the scientific consensus, the body of evidence on a topic. It's never going to be one study. It's always the body of evidence, because evidence matters. And there's a little bit of research that shows that this can make a difference. This is research coming from the vaccination world. And it's also, I think, really important to highlight that science evolves. And as science evolves, as the evidence evolves, so too will the recommendations. Be nice, be authentic, and be humble. I think that is really important. And there's actually pretty good evidence to back that up. It sounds like I'm just using these motherhood statements, but there's evidence to back that up. If you use aggressive language, if you are more likely to be seen as not being credible, right? So being humble, being empathetic, it really does increase the likelihood that you're going to be heard and you're going to be believed. So this matters, right? So this is something that we should do. And the other thing that we should do is we should think of creative communication strategies. We should think about art. We should think about videos. And we should think about using a powerful narrative. So much of the misinformation is spread because of the powerful use of testimonials and anecdotes. And our own research has shown that, the testimonials and anecdotes are often used to spread misinformation. Well, let's use those strategies also to spread the good stuff, right? And other creative communication strategies. So let's do that. And if we do, it can work. As I said before, highlight the gaps in the logical fallacies that are used. Make the fact, make the correction, right? Make the truth the hook, not the misinformation, because we don't want to play to the illusory truth phenomenon. We want to make the truth the memorable part of whatever your message is. That's important also. And the last thing I think is also really key, and this is something I fall into sometimes. You can't help arguing with a denier. don't, right? Don't. Always remember that the general public is your audience. The general public is your audience. It is very difficult to change the minds of hardcore deniers. So what you can do is use a ridiculous statement by a hardcore denier or a celebrity or a politician as an excuse to talk about the science. But remember that it is going to be difficult to change, this person's mind. You're not going to change the person who believes in medical fascism. You're not going to change that person's mind. Think about the general public when you're messaging. And this is from the World Health Organization. They call this rule number 1 of science communication. The general public is your target audience, not those hardcore deniers. And this is true about vaccines, but it's true about everything that I've talked about today. And the last thing I want to highlight is that we also need to encourage, as I said before, remember, this is largely a bottom-up phenomenon. People are spreading this misinformation on social media. So what we want to do is we want to encourage a culture of accuracy, right? We want to nudge individuals to think before they share. And my colleague, Gordon Pennycook, who's in Saskatchewan, has done really interesting research on this. And he has found that if you can do that, if you can just get people to think about accuracy, you're likely to stop, to have some impact anyway on the spread of misinformation. People are less likely to spread information. People want to be accurate. So if you can just remind them, nudge them to think about accuracy. And here's some unpublished data, again, as part of our research team. Gordon Pennycook's leading this. He found exactly that. He found that if you can nudge people to think about accuracy in the context of COVID-19, we can have some impact. It's not going to fix everything, some impact on the spread of misinformation. So sort of building on the spirit of that research, we partnered with Media Smarts on this ad campaign, this public campaign that just came out a few weeks ago to really encourage Canadians to do that, right? To encourage Canadians to check before they share, check then share.ca. We think that this is an evidence-based, straightforward strategy that we can implement to try to nudge people in the right direction. So I encourage everyone to check out this campaign and please share this, share this information. You don't need to check, just share it. It's got some great graphics. So I ask everyone, check first, share after. And with that, I'm going to say thank you very much for this opportunity. And I really look forward to hearing your questions. Great. Thanks, guys.
It had to happen. I had to be muted. Apologies. Thank you very much, Tim. And now, Barbara, let's hear about some of the safe harbors providing trustworthy information as the infodemic rages around them, and how to assess the quality of the information available on the internet.
Okay, thanks, Nicole. I hope everyone can hear me all right. So, can you trust Dr. Google? This is an interesting question because not really, but you can come to trust in your own ability to judge information you find on the internet. And there are reliable sources of health information that you can turn to. So next slide, please. Next slide. Okay, so first a bit of housekeeping. I have this disclosure slide that describes how CADTH is funded, and it tells you that I'm a CADTH employee, which is why I'm confident in telling you that the CADTH website is a reliable source of information. And in response to the pandemic, CADTH launched its COVID-19 evidence portal, which you can see on the screen here. So if you really want to know what the evidence says about COVID-19, you can look here. And when you're hearing about shiny and sensational new things about the coronavirus, this web portal can be your reality check. So here you can find lots of trustworthy resources, including the latest CADTH evidence on various COVID-19 topics, including the prevention, control, screening, testing, and treatment of COVID-19, as well as on mental health topics. And it also includes links to COVID-19 resources from other trusted pan-Canadian and international organizations, And it has links to public health guidance from the federal government and each of the provincial and territorial governments, all in one place. And if you're a CADTH customer and you don't see the information you're looking for here, you can request a review by clicking on Ask CADTH at the top of the page there. Okay, so next slide, please. So the next slide, I'm showing a website that provides links to resources for the general public on a wide variety of health topics. This is the Medical Library Association, or MLA, list of top health websites. I have a page devoted to COVID-19 resources shown here. It has several links to credible websites on COVID-19, a wide variety of formats, info sheets, videos, even educational comics, which are pretty cool. Just a note though, this is a US site, so public health guidance you get here is from the CDC and state health authorities. So for public health info, get it from our federal, provincial, and territorial governments instead. Now, I know that the CADTH website is a trustworthy source because I know that CADTH strives to provide high quality, objective, evidence-based information. But why am I confident about the credibility of websites on this MLA website? Well, it's because I know that the MLA assesses these websites against a set of criteria to determine if they're reliable. Next slide, please. So using criteria to assess health websites is not at all a new concept. In fact, in the 1990s, shortly after the internet became available to everyone, it was soon recognized that there could be risks involved with the public then getting health information from the World Wide Web. So back then, an international not-for-profit organization was created called Health on the Net, or HON, to assess the credibility of internet-based health information. And they did this by developing a set of criteria, which you can see listed here. And this happens to be the criteria that the MLA uses to assess their content on their top health websites list. So next slide, please. So we can make a point of visiting credible websites to get our reliable health information, but we'll inevitably find or be exposed to information from elsewhere on the internet. And that's where having some criteria in the back of our mind to help us judge these other health websites can prompt us to pause and ask ourselves, should we trust this information? Do we really want to make a health-related decision based on it? And is it helpful or is it harmful to share this information with others? Next slide, please. So CADTH came up with its own list of criteria featured on this handout called Evaluating the Credibility of Health Websites. Can you trust Dr. Google? And CADTH produced this guidance before the pandemic, but it seems even more relevant now. This handout was developed for a pretty broad audience because really all of us get our health information from the internet, and knowing what's reliable and what isn't can be tricky for everyone. Well, I mean, except for researchers and academics, because they've been trained to think critically and to sniff out unreliable information, but really anyone can learn to do this. Next slide, please. So here are the 6 criteria from the CADTH Dr. Google tool, and if you adopt this approach to evaluating health websites, it'll help you decide how much trust you want to place in the information you find. And I've ordered the criteria this way as a memory aid for myself, because then the first letters of each spell you adopt. But anyway, now I'm going to go over each of these criteria. Next slide, please. Usability. So is the website easy to use, well organized, well designed? If so, the site will be more likely to be trustworthy, but also a well organized site will make it easier for you to find the information you'll be looking for to assess all the rest of these criteria. Next slide, please. So author, who wrote the content? Think about if they're a qualified source. Knowing who the author is and their qualifications will help you decide how much trust you want to put in what they've written. So consider it a red flag, a danger sign, if you can't tell who the author of the content is or what qualifications they have. And you should be able to see if there's an editorial board responsible for reviewing the content posted on the website. Next slide, please. Is the scientific information current? So check whether the reference studies are old, but keep in mind what might be considered old, though, depends on the subject matter. So a health topic that's well researched and long understood probably might have changed from 5 or 10 years ago, but when it comes to COVID-19, information from 5 or 10 days ago could be out of date. Links are broken. So if there's links broken, it could mean the website hasn't been updated recently, another sign that the information could be out of date. Next slide, please. Objectivity. Is the information facts-based and balanced? And by balanced, does it mean, I mean that you have to look to see if the website tells you how this treatment works, but also side effects. Does it tell you about other treatment options? And it should always remind you to check with your doctor. Be cautious if you're unclear what conflict of interest the author might have, like any personal or financial benefit they can gain if you buy into what they're saying. And be careful if the site suggests that a treatment works for everyone, or if the evidence they present is one person's experience, like the author's own, or if it's in the form of personal testimonials. And statements like miracle cure, breakthrough, or they want to keep this information from you, wording that's dramatic, overly emotional, or scary, that's a common persuasive tactic in false information. So if you feel your attention is really being grabbed, then it's probably a good sign to pull your attention back for a moment and assess the information carefully. Next slide, please. You should be able to tell what the purpose of the website is. And if it looks like the purpose is to sell you something, that's a huge red flag. Now, it's okay if there's advertising on the website, it should just be clearly marked and separate from the main content. Next slide, please. And finally, transparency. You should be able to tell who owns the website, look for an About Us or Who We Are page, and you should be able to find out how the website owners collect and use your personal information when you're on the website. So you should see something like a privacy policy or a terms of use statement. So keeping these criteria in the back of your mind will help guide you when you're deciding how much trust you want to put in the information. But you could take assessment to the next level and use a systematic process to score health websites. Next slide, please. So here's an established yet simple scoring tool, JAMA benchmarks, from the Journal of the American Medical Association. It's a scoring tool consisting of 4 criteria: authorship, attribution, disclosure, and currency. Super simple, 1 point per criterion, score out of 4. Next slide, please. Or if you want to use a much more complex scoring system, there's the Discern instrument. This was developed actually as a patient tool by the National Health Service in the UK. It's a step-by-step process where you answer these 15 questions by rating them on a scale of 1 to 5 and then come up with an overall score. And the Discern website provides instructions, examples, and guidance to help you step-by-step through this process. Next slide, please. So before I end my presentation, I want to bring your attention to this CADTH handout shown here. The CADTH handout is called What You Should Know About Drug Treatments for COVID-19. Spoiler alert, there are currently no proven drug treatments for COVID-19. The development of this handout was prompted by a CADTH customer request for a tool to address misinformation about COVID-19 treatments. That is, like, to explain there isn't good evidence to support claims of their effectiveness and to describe the risks of using unproven COVID-19 drug therapies. It also includes red flags to look for when getting health info off the internet, and it provides a list of sites that provide trustworthy and plain language information on COVID-19. The handout is intended for the general public, or it can be used by healthcare providers when discussing COVID-19 with patients. And this is available on the CADTH COVID-19 portal under treatment in the CADTH evidence section. Next slide, please. So people take what they read about health on the internet at face value, which is not a problem if they're getting information from reliable sources. But given how much information we're exposed to from less credible sources, people need a reminder to pause and assess the credibility of any website they're getting health information from, and to double check the information by seeing what a credible source has to say on the topic. And this is a habit that I think most people can learn. And with that, I'll pass it back over to Nicole.
Thank you, Barbara. Now we have a few minutes, maybe about 15 minutes for questions. As a reminder, you can submit your questions using the Q&A button or the tab at the bottom of the control bar. And maybe what I could do is I can kickstart the questions. And my first question will be for you, Tim. It often feels like there is a war on science. You're hearing there are plenty of examples. You've noted some of them around vaccination, climate change, and perhaps even now COVID-19 with some of the treatments, where opinion really seems to matter more than actual evidence and facts. Do you agree that science is under attack? And is there still, is evidence still important for policy decision making?
It does feel like there's a war on science, and not surprisingly, it's actually a kind of a complex phenomenon. If we went on the street and we asked people, "Do you trust scientists? Do you trust your healthcare provider?" Most Canadians still say yes. There has been an erosion, and also we need to put this in the context of the broader trust problem. Right? The COVID emerged at a time when there was already, depending on what survey you look at, what study you look at, record low levels of trust in our institutions. So this, I do think this is problematic. I said that most Canadians trust scientists and scientific institutions and healthcare providers, but it's fascinating. If you go and then ask them about specific things, vaccines, GMOs, alternative therapies, that trust can break down. So I think one of the things that one of the legacies of COVID, I think, is going to be this, a deeper understanding of how incredibly important it is to have trustworthy institutions. And we need to take very seriously we need to listen. Why aren't people trusting these institutions anymore? Yes, I know there's systemic issues that are very difficult to address, but I think we need to really consider very carefully why the trust is breaking down and what we can do about it as professionals, as an institution, and really as a society. I do think part of the answer, I'm a big believer in this, is communication, is engagement, is transparency, and I think we're starting to see institutions take that much more seriously.
Thank you very much. Barbara, just a quick starter question for you, and then I see the question and answer section is actually blowing up here, which is great. If you find a website that is clearly full of information, is there anything you can do about it other than just simply ignore it?
Well, there are things that, like Professor Caulfield was talking about, things that regulators and social media companies can do or are doing to counter misinformation, and like that social media smarts campaign, I think that's really encouraging. But for individuals who are coming across a website, is there anything an individual can do other than simply ignore it? I would say, if you just choose to ignore it, I think ignoring it is a good start. You're not being duped yourself, and you're making sure that you're not contributing to the spread of misinformation. But beyond that, I mean, I think if it's a website that's being shared with you or information that's being shared with you, then there's a great opportunity for you to try some effective debunking yourself. Start a conversation, maybe just a question or two about where did you find this information? When was it posted? And I guess depending on the situation, that's a chance for you to point out some red flags you see. Kindly mention, did you notice this website is owned by a group that spreads conspiracy theories, or this research seems so preliminary, would you make a decision based on it? Because maybe that person had never considered second guessing that information, or they might not even know what to look for. So I think these are great opportunities to nudge or encourage others to stop and check the credibility of what they're reading and sharing.
Thanks so much, Barbara. So I'm now going to turn over to the question and answer section here. And there seems to be a theme around what can scientists do to help dispel this information? There are organizations, and one question points to the US Public Goods Project recruiting and organizing members of the public and or science? How do we do this in Canada?
I think the good news is, and I'm seeing a lot of these themes in these questions too. I think the good news is, again, another legacy from the coronavirus is the mobilization, right? The mobilization of the scientific community against misinformation. I think people are taking this. I've been doing this for decades, and I'll tell you, people don't see this as a fringe topic anymore. You know, you started the webinar referring to the World Health Organization, noting that this is an infodemic, and so people are taking this very seriously. So that is good news, right? And the other good news is, and I referred to some of the studies today, but there's a lot more out there. We're seeing more research. We're seeing more research. It's hard to study this well. You know, it's hard to get really good empirical data on how to do this, but we are starting to see more research on how we can push back. So the scientific community, I think, we're starting to get information on what the scientific community can do. And I think they do need to get on social media. They do need to post shareable content that engages the public in a respectful manner. It's not always easy to do that. I often fail. You know, I think it's okay to be snarky when you're talking to Tom Brady, maybe not to someone who's interested from the general public. These are actions that people absolutely can take. And the other thing, I don't want to take up too much time because we have a lot of questions, but the other thing I think is that scientific organizations, I think, can take stronger stands on pseudoscience. Early in the pandemic, I made this argument that we've tolerated pseudoscience for too long. You know, there has been this sort of acceptance of pseudoscience. But look, boosting your immune system was bunk before the pandemic. It was a stupid idea that before. It's bunk now, and it's going to be bunk after, right? So let's not tolerate pseudoscientific ideas, because it makes it much more difficult to get rid of them when we really want to get rid of them, like right now during a pandemic. And so I think that's something that scientific organizations, health professional organizations can do more of, you know, come out with those statements about where the science really is.
Thank you. And as a follow-up to that, perhaps for Barbara and back to you, Tim, what kind of training do you think we need, or education around this? So is it only at the university level? Is it a public engagement campaign? Are there other ways that we can continue to raise the awareness of the fact that there could be misinformation out there? Perhaps Barbara first.
Okay. Well, I think it's important to get young people engaged in understanding misinformation and how to, you know, effective debunking and those sorts of skills, especially thinking that during this time of COVID-19 and this infodemic, there are young people, this may be their first exposure to health information and misinformation. So I think these sorts of critical thinking skills are really important for young people to learn as soon as they're able to learn about it. Because for people who've been around for longer, maybe we've learned these skills, but it must be confusing for young people who just are starting to think, I don't know what to believe and how to parse through this information. I think it's quite more dangerous for the young people, and so I think it should start early.
Real quick point on that. You know, I think I totally agree with Barbara that, you know, critical thinking skills so important. And if you look at that study from Carleton, they found that people in the younger demographic tended to believe the conspiracy theories more. Now they're speculating. They didn't actually study this, but the researchers from Carleton are speculating that that's because of the exposure to social media, not that they're actually, you know, more susceptible or more gullible, but they just see it more, right? So that goes to that near exposure effect, you know, those cognitive biases that we all have. But the other really important thing is I think that people recognize that misinformation is out there. You look at the studies that are coming out right now, people, you know, admit that they've seen it. There was a study before the pandemic that, you know, something like 90% of Canadians admitted that they'd fallen for fake news. So I think we recognize the problems there. The bigger challenge, and Barbara touched on this, is really educating people how to tease out what's real and what's not real. And so I think that's where, you know, a lot of our focus should be, and just inviting people to think about accuracy before they share.
Thank you. One additional comment for Tim, and this is directed to you. about being surprised that that there wasn't a discussion about the role that social media has been playing, and maybe how they can step up during the COVID-19 example, removing myths or removing falsehoods. And can you comment on the impact and status of what some social media platforms are doing?
Yeah, excellent question. And I'm fascinated by that. One of the reasons I avoided it, I just had that one quick slide, is it is so complex. So, I think it's good. The good news, again, let's start with the good news. As always, all the platforms seem to be recognizing their role, right? Even if you go back a year ago or a little bit more, they weren't doing as much, but they have recognized the role. So we have redirects. A lot of the platforms, if you put in something about the coronavirus, you get redirected, or at least a flag to go to this trusted sources. That's good news. They are putting up warnings on some of even the president of the United States has got this on some of them. That's good news. We're seeing some things be banned, like that pandemic thing was pulled off of YouTube. I think that is good. But the real challenge is you want this stuff to be evidence-based. And Gordon Pennycook, again, I've referred to him a couple times here. He's done interesting research that shows that some of these things, they do work, but they can backfire. So, for example, his research found there's the illusory truth phenomenon, where as if something doesn't have a flag on it, it's perceived to be more true than it would be otherwise. You follow that? So everything that isn't flagged to be not true is viewed to be more true than it actually is. And so we do need to make sure that this is evidence-based. And then, of course, and this is something our team is working on right now, my colleague Blake is digging into this. There is a freedom of expression issue here, right? Do we really want these private entities to have unilateral control over what we see and believe? I mean, they control our universe right now. So we'll see where our research goes, but wouldn't it be nice to have some kind of independent oversight of some of these activities? I'm dreaming, I know, a man can dream, but I think this is a really complex, empirically, but also from a policy perspective.
Thank you. And Barbara, we're seeing some commentary around utilizing schools and education and students and to be taught how this critical appraisal piece early on in their education journey. So I think that's all the time we have for questions. There are lots of questions, and a lot of the themes are around retractions or how do we educate people. Certainly the most common theme that I've seen in the questions are around how does the science community evolve around this so we don't erode science in general. So thank you again. But before I go, I'd like to give each of the speakers an opportunity for a final word. Barbara, I'm going to, in less than a minute, if people only remember one thing from this webinar, what would you like it to be?
Well, I guess I'd say that although the uptake and spread of false and misleading health information on the internet isn't a new problem, that COVID-19 has really shone a big spotlight on the issue. And I mean, it's great to hear what Timothy Caulfield was saying about what scientific organizations can do and the medical community. This is an opportunity for them. And I agree. I think it's a reminder that
oh, we may have frozen. All right, we'll hopefully catch up with Barbara beyond. Oh,
it's an opportunity to get us into good habits that'll benefit us like long after this pandemic is over.
Thank you. And then Tim, I'm going to throw the last comment or question to you. What is the key takeaway message from your perspective?
You can probably guess what I'm going to say. I'm going to say that battling misinformation works. We need to get together. I agree with Barbara. Let's use this as an opportunity to recognize how important good science is, how important trustworthy science is, and how important it is to fight misinformation. So yes, evidence matters, right? Evidence matters. Let's make sure that is one of the legacies of this. So I hope that everyone gets engaged with this topic. We increase the public discussion around good science. So yeah, evidence matters. And finally, I'll say what I always say: go science.
Rah, rah, rah. And for those of you who are familiar with CADTH, they might have heard that evidence matters catchphrase before. So that's great. So I just wanted to say a big thank you to both of our speakers and to everyone who joined us today for the webinar. The webinar has been recorded. I've seen some questions and comments about can we have slides. It's been recorded and will be posted on YouTube later on this week. And we'd really like to hear from you. So there will be a survey at the end of this, a short evaluation survey. And if you open a window once the webinar exits, we'd like to hear from you and even potential topics or upcoming thoughts. And we've already heard that from some of the commentary on the question and answer, and this was a lot around websites, social media, but there could be a broader perspective on science and how to continue to have good science out there and what is required in order to do that. So CADTH has several more webinars in the works for July, and please watch the CADTH website for details on that. And with that, see you next time, and please stay safe.